Good evening, everybody, and warm welcome to the Fireside Chat for the month of April. We've had a brilliant 12 sessions of Fireside Chats before this throughout last year, and these have become so popular that due to popular demand, I think Thankam and I are absolutely committed to holding these Fireside Chats with the leaders of the nursing fraternity of the country, because these are not just an evening's easy conversation by the fireside, but these are really leadership capsules distilled, which you can review over and over again. A fantastic learning ground for young nurses, for students, for aspiring nursing leaders. Really, so we've enjoyed doing this over the last year, and we thank our audience for always being there to support us. So a very, very warm welcome to all of you. Today's guest is Dr. Elizabeth Joseph. I don't think she really needs an introduction. Many of you would know her, but a veteran of the Indian nursing fraternity. We were just chatting before this, and she spent 22 years with one group. Isn't that a phenomenal achievement? 22 years. And again, she's one of those, rare breed of nursing leaders who have had stints in both nursing academics as well as the grind of running corporate hospital chains with all of its associated pressures. So she's done both and with aplomb. Out and out Mumbaiker, born and brought up in Bombay. She did all her studies in Bombay from SNDT University. And then, of course, she's had a brilliant career, of which most of which has been with the Wockhardt Group. Before that, she's been in academics for a couple of years. And if I'm not mistaken, I think she's even had one stint abroad there. So a very warm welcome. This year, she's just retired after 22 years of yeoman service from the Wockhardt Group, and is now currently spending time with her family. Her daughters just got married, and as we were discussing just before this conversation started, the world is her oyster. She's now a free bird with both children now, away from home, and all best wishes for this wonderful next track of your career. So with that, very warm welcome also to our host for the evening, Thankam Gomez, the one and only, and I don't need to introduce her. We are so proud at Nurse India to have her as our partner. She also runs her own company, Signia Healthcare Academy, founder president of Annie, and as Dr. Elizabeth Joseph said, Thankam's really omnipresent in everything in nursing. And she does it with her style, with her panache, giving confidence. So without much ado, we would like to cover quite a bit. Uh, Handing it over to Thankam.
Thank you, Indrani. Good evening, everyone. Very happy to see all of you here, and very, very good evening, Dr. Elizabeth Joseph. I will call you Elizabeth, you know,
Yeah,
just to introduce. So, first of all, let me ask you, how are you feeling?
it feels good. I mean, to be on a show like this where there's a platform for me to share my experiences, some things which are very personal. I see some names here who have worked with me for so many years. Some of them may know what I'm talking today. Some of them, it may be a surprise for them. So it feels good.
Okay, great, great, great. So, as usual, we would like to you know, go a little behind the Dr. Elizabeth Joseph. Many people have, come to know. Maybe some of them might be knowing you a little bit more personally. So, I have met you long time ago when I was in Fortis,
Yeah.
when I was the group head. I think I had come to Faridabad, and you were doing the NABH assessment. You were there as an assessor. I remember being very impressed after meeting you. I only remember that feeling. I was very impressed. And even today, I'm very impressed
Thank
with
you.
you. And I'm very proud that, you, I mean, you are in that club where you bring pride to the profession, right? So, just let's rewind some time back and see that. when you were in school or college or something, how did you think of becoming a nurse? Or did you have some other aspirations?
So, coming into nursing, and if you remember, Tangam, those days, when it comes to profession, the choices were very limited. And I'm talking in at least about 30 years ago. And just few professions that people would get into. And like any other girl, I just finished my 12th and I was wondering what to do. One of my neighbor, who's like a year senior to me, happened to join SNDT University, and uh, she kept talking to me about her experiences, about how difficult it was to get into for the admission. It was a 3 day interview session, and they had so many selection criterias, and they had about 700 or 800 candidates come in, of which only 50 or 55 get selected. And then throughout the year, I kept listening to her stories about going to hospitals, taking care of patients. And I think that sort of, stimulated me. And I said, okay, why not try this? And the next year, I went for the interview, and by God's grace, I got into nursing. And that's how my career started without actually not knowing fully well what I'm getting into. It's just those few stories that I kept listening from her, like I took care of so and so patient, and the patient was happy. And I said, okay, so this is something where I can give to the society. Why not start this? So that was a turning point in my life.
Okay, join the club. I also joined nursing without knowing what is nursing about because I wanted to be a doctor. Simple. I did not know what doctor is about, but I wanted to be doctor. When I could not, then I said the next one standing next to the doctor is nurse.
Yeah,
But definitely, I have no regrets, and I'm very sure that you also don't have any
absolutely.
regrets for being
Absolutely.
a nurse. But I am very sure that the journey had not been very easy, also. Is that right?
Absolutely. It wasn't a easy journey.
Okay, but before that, let's go back to our SNDT time. What are some of those great memories that you have while you were studying nursing in SNDT? Because SNDT is a premier institute of the country, and I was not aware of SNDT. I came to know about it much later. So you can also tell a little bit about SNDT. How old is the SNDT? And so in Maharashtra, you ask anyone, everybody is studying in SNDT, right? And I'm very sure just now you mentioned 700 candidates, applying to SNDT. So what is so special about it? In North, we have something called RK College of Nursing in Delhi. So I kind of hold it at the same level, RK and SNDT. So there are two, three questions there. How was your life in college, and what are some of the things you enjoy doing? And is there something that you would like to tell us you did not tell anybody about? Which is okay. Okay,
Hmm.
after some years, no, those secrets no more remain a secret. It becomes
Secret.
fun, right? So over to you.
So SNDT, of course, will always be very, very special to me. Life at SNDT was not very easy. Um, to begin with, we did not have a college of a hospital of our own. It's a university where we only had a college, and we had to be going to all the possible municipal and government hospitals for our clinical experience. Okay. The good part of it is that we could really, we were really hands-on, because the state of government and municipal hospital, they are like flooded with patients. And they are patients. I shouldn't be saying this, but we all know the fact that they're patients from the weaker economic part of the society, and doing anything for them, even the smallest thing, they're so, so grateful to us. And the good part of SNDT was also, I think, the strength and the pillar were the teachers that we had, some very senior teachers, and they were so committed to the cause of teaching. As first year students, if we have to be in the department at 7 o'clock, the teachers would be there at quarter to seven, because our principal, she's no more now, but she's a big, big role model to me, Madam Joy Kuti. I'm sure most of you would have heard about her. Her objective, or her logic was, when a first year student comes into the ward, she doesn't really know anything. And it's important that the teacher must be in the unit to receive her, make her comfortable, and give her directions. And if you go to see now, how many of our teachers are really there? Forget seven, I think eight and nine also, some of our teachers are not in the clinical unit. Uh, each teacher had about 8 to 10 students. So she would give quality time with the students, actually supervising and handholding them. We had the system where if you have to do any care for the patient, those days we were very procedure oriented, like now after so many years, I can understand how we have matured into from being a novice nurse to an expert. When you actually look at the various growth phases that we go to as first year students, we were very procedure focused. So if there is a patient who requires say a back care to be given or enema to be given, we are very excited because we're only focusing on the procedures. So we would have all these procedures being practiced in the demonstration room. You have to show and keep demonstrating the procedures till the teachers are very sure that you can do it independently on your patients. Only then they allow you to do it. And even there in the wards, they would they would ask you to do under supervision. So you keep the tray ready. The teachers have to come. They will stand there. They'll make sure they are seeing, they are monitoring what you're doing, and only then they will allow you to do. So that was the intensity of supervision that we had. Sometimes it was annoying that these teachers, and we would compare ourselves with the students over there, like KEM Hospital, and where the students were left on their own. They would do things and we say, how nice. Yeah, the teachers come, they come for supervision, but it's not like 7 hours or 8 hours that the teachers are constantly with the students. So that was a level of the care, I should say, that the students got, the level of supervision. Of course, we never really liked it then, but today all of us value that. Um, some of the good things, I mean, some naughty things that we did there, yeah. So we had this thing, where we were posted in Tata Hospital. And Tata Hospital is a very, very confusing building because it has an annexure building. And we were, 8 students were put in different wards, the chemo department, the radiation therapy, and, different cells. And students being students that we are, we would keep roaming around the entire hospital except being in the unit. And when the teachers would come and ask, where were you, ma'am? We had gone for a short break because canteen was somewhere else. The unit that we were working were in somewhere else. So those days we really took our teachers for a ride. And then, as luck may have it, they say, karma comes back to you. When I got into teaching, I was given Tata Hospital. And I knew what students could do. So I had told them very clearly, when I come for rounds, and if you're not in your department, you will be marked absent. Your breaks will be from this time to this time. Your tea break is this time to this time. Lunch break is this time to this time. The rest of the time, I need to see you in the department. So I managed to see through that. As a student, it was a different picture. As a teacher, it was a different picture altogether.
I think that evolving from one stage to the other and knowing that this is what I need to correct is important, right? I think we all have had our naughty days and naughty times,
Yeah.
So after you finished your graduation from SNDT, then what did you do?
I joined Just Look Hospital and Research Center as a staff nurse. I worked there as a critical care nurse for about 1.5 years.
Mm-hmm.
And then that was a time people were all looking to go abroad. And I don't know why, but even I wanted to go abroad. But my aim was very clear. I had no plans of wanting to settle down there. I was just curious to know what nursing abroad is all about. Like, and that's the time Defense Hospital from Bahrain had come down for interview.
Mm-hmm.
As luck would have it again, when my friends went for the interview, the main uh, dates that were scheduled for interview, uh, I think I had got night out and I had gone home. So those days I was staying in the hostel. And we came back on the day. They said the interviews are over. I don't think you'll get a chance to go. So we said, okay, fine. But somebody from the recruitment cell called up and said, if you still have BSc nurses with ICU experience, please ask them to come. So a friend of mine, Mabel, both of us went, and we were not very sure of it was in some particular hotel that this interview was being conducted. We got the name of the hotel wrong. We were not very sure where this hotel is, whom do we have to meet. We kept roaming around in that hot sun. Finally, I told Mabel, chal, yeah, let's go. Enough is enough. So she said, one last round, yeah, let's get into this place and see. As we entered the hotel, the entire team was coming down with their bags and baggages, ready to check out of the hotel. And the lady who was interviewing us, she said, "Have you come for interview?" We said, "Yes." By then, she got to know about SNDT. "Oh, you're SNDT graduates?" "Yes." Have you all worked in the ICU?" "Yes." "Have you all handled patients on ventilator?" "Yes." "Okay, sign the contract." So, so that's how we went. That was the stint that I had gone abroad. So 1.5 years I worked abroad again in just look in a defense hospital in Bharat. The exposure did me very good because I actually got to see how nurses at the international fraternity work, actually saw how patient endorsement happened, how narcotics are being handled, because those are things which didn't happen in our country at that time. Importance of documentation and how meticulously they maintain documents for the patient. I was very clear that I wanted to do masters. So when entrance exams were getting scheduled, I came back to do my to give my entrance exam, not expecting that I would clear because there were only 16 seats that were available at that time, and we have a lot of people applying for masters. But again, managed to clear the entrance. So though I was on a 2-year contract, I came back within 1.5 years, and they allowed me to come back because I was going for higher education. So 3 years of clinical experience. And once I completed my master's, as I was completing my master's, I got married as well. My husband was working at Aurangabad. So then about 5 to 7 years, I think 7 years of teaching experience. At SNDT, 5 years, another 2 years at Aurangabad. And
Okay.
after that, the whole stint was in Wokhart Hospital.
Oh, okay. So while you were talking about your Mumbai Mumbai episode, I was thinking about me and my friend going to Mumbai. After I returned from Saudi, I spent some 7 years. We came back, and I was wanting to find a good corporate hospital like the one I worked there. Then I did not find, and neither the salary was right. So I said it's not worth it. So someone told there is interview for Kuwait in Mumbai. So me and my friend, we landed up in Mumbai. That's another story. All that train rides and how many dupattas
Yeah.
I lost and all that stuff is a different story. I had no idea that how you should put dupatta. So lot of people said, "Why are you wearing your dupatta like this? You should wear like this. Otherwise, you can get strangled." I said, "Oh
Yeah.
my God, okay." So it's similar kind of a thing. I was just thinking that we were looking for this. The Kuwait thing, of course, we wrote, and I was very sure that I have passed. But those agents were taking money and putting people into the list. So I went and fought with them also. I said, "Show me my paper." I said, "I'm a cardiology nurse. There is no way I would fail. You show me my paper. Let me see that I failed." Then my friend said, "Don't fight, let's go." Then when we came out, someone told that there is a Doha interview going. So we had no idea. We walked like this, from this place to that place. And finally, when we reached there, they were also coming down with the bag. Then that guy told, yes. So I said, ICU nurses. So he said, khalas, the way they say, no, khalas.
Yeah.
So I told a little bit in Arabic, wallahi khalas, anayal marita, anayal murakasa marita ana. Huh? 7 years, huh? Then he said, what? So I said, you don't want ICU nurse, and if he Arabic first, soya. So little bit of Arabic, they allowed me to go inside. And my friend also, she had NICU experience and I had adult ICU experience. So we were able to see the assistant director of nursing. So she said, at least we are happy. Finally, we found you. So what I'm saying is when destiny has something
Yeah.
there for you,
Yes.
it cannot go anywhere. Correct? So do you have something like that in your life where you thought, you talked about karma now, that karma came back. So how about the destiny part of it? Or you call it the providence has got a plan. So something like that played in your life?
I think this whole cycle, I mean, the whole thing which has gone on in my life, starting from, getting into nursing, meeting up with certain people, uh, having met up with certain students who still keep in touch with me. I don't know it, and getting into NABH, becoming an assessor, meeting up with people across the country, because when you need some help, you know, you have met somebody and you're like destined to, that person is destined to help you out. So I think when you sit back and when you reflect why certain things have happened in your life, you say, okay, fine, this is the answer for it, and I mean, you don't know whether this is the right or wrong, but at the same time, you feel probably it was meant to be the way. So, like now, for example, uh, 2 months ago, I had given an interview somewhere and everything was cleared, and I was almost on the verge of joining. And some reason and I thought it was coming through, and then for some reason it fizzled out. And I was a little upset because the profile excited me, and I said, well, it sounds really good, and nothing can be better than this, is what I thought at that time. But 2 months down the line, I'm getting offers, which I find is much better, which is suiting me, which is suiting my family as well. And it's like a jigsaw puzzle falling into place. At 2 months ago, I was very upset and I kept asking God, why did you do this? I mean, like, I never knew about that place. I never knew about that company. I never knew anything. You were the one who put this forward to me. And you were the one who made me go through those interviews, which were difficult. I cleared the interviews. And then why are you taking this away from me? And 2 months later, I had some answers coming. And I said, okay, there's some visibility coming. Something is happening. So some things are, and what I'm learning, though I believe that whatever happens, happens for good. But while you are in that position, you don't want to accept that. Saying you keep asking yourself, why is it happening? It could have been a little better for me. So yeah,
I think I echo your feelings, and I have stopped asking why me now for many, many years. Because I think many years ago, I realized whatever is happening to me is the best that can happen to me as Sankam. That's what it is, you know.
yeah, yeah.
And the jigsaw puzzles,
Puzzle.
he is so correct, you know.
Yes,
I
yes.
always say it is like a big, that maze that is in front of the creator, and he knows this is Tankam's life, and he will move the right pieces at the right time. Even when he is moving the wrong pieces, it's with a purpose, because there is
Yeah,
always a
yeah,
learning. I'm
yeah,
very sure there is always a learning. When you go for an interview, if you don't make it, there is still a learning, but it hurts. We are all human beings. It
yeah,
hurts a little bit, you know.
yeah.
So I think that the more the more we trust that the universe will do the best for you, I think the more calmer we become,
True.
right? And this is something that I have learned so many years ago. And that has given me the strength to be, really patient about people, patient about many things. And at the same time, still, hungry for changes and new things like that. So, what kept you excited? So, before that, I want to ask you a question. You were happily working in SNDT, then Aurangabad. How did you decide to get into this crazy world of services?
Yeah, crazy. That is the word actually. I was working at SNDT Tangam for almost 5 years. So 2 years I worked there, and then that's the time I got a chance to go to UK. I was on a PN Berry scholarship to London for a year. And there again, I could have continued, but I didn't want to, and I came back. By then, I had a daughter who was almost about 5 years. The elder one was 5 years. So, because I got the scholarship, I went to London and I wanted to learn something about mental health because I had completed my master's in mental health. And mental health is, at least about 30 years ago, was not as evolved in India as, that I had seen in the UK. So, at the end of the scholarship, I came back to SNDT and I continued working there for 3 years. And I was very happy working there. I mean, I never ever aspired for nursing leadership or a number one position. I was very happy there in a good comfort zone because, my husband and my brother used to make fun of me. You are more at home than at work. At LT at LT College of Nursing, we would get our 15 days of Diwali vacation, 15 days of Christmas vacation, about 30, 45 days of summer vacation, all the public holidays, 5 days working. Saturday, Sunday, you're not working. So when
Oh,
the child is at home, you're at home. You don't have to ask for any extra leave. It was very comfortable. And but what happened was the university had certain rules changed. So they would recruit candidates against certain categories, and we happened to come in the open category. So it was always a temporary post that we were on, and that was a position that had to be interviewed every year, which also was okay with me. But then they again came down that they had said that salary is something that they started compromising. They gave a consolidated salary of, the amount was really, really piddly. And that's the time some of us started looking out for an opportunity. And destiny again called this, if you can say so. The chief of nursing at Wokhard Hospital then, Madam Judith Verma, she came down to our college during the college day fest. And she was just sitting next to Madam Alka, who was our vice principal, and I was sitting next to Madam Alka. So she said, I'm looking for a nurse educator who's staying somewhere that side. If you know of somebody, please, can you refer someone? And Madam Alka knew that I was looking for something. And I live in Chembur, which is not very far away from Mulund. So she turned to me and said, do you want to apply for this position? I said, yeah, why not? And that's how I got into the service side. So I joined Wokhard Hospital as a nurse educator. And 6 months of my joining, the chief of nursing left. We all knew that she would be leaving because she was planning to go to the US at that time. But till the day she left, we had no clue as to who's going to take charge of the department. Next day morning, I was summoned to the office of Dr. Lloyd Nazareth, who was the head of the hospital at that time, and he said, Elizabeth, like giving what do you say, some
command.
command to go to the battlefield, and you have to take charge of the nursing department now. Okay, and then he started that, and I shut off after that. I didn't know what he was saying. I just came back to my office. My friends were there. I said, I don't want to do this. I'm running away from this hospital. I don't think I can do this because I had absolutely no experience as an administrator. Neither did I work with an administrator at very close angles to understand what nursing administration is all about. So I was pushed into this crazy role, as you can say. Very, very difficult days initially, because every time I took a decision, I would ponder, like, did I take the right decision? Was anything else? I mean, could I have done something better? And there were one or two very senior nurses whom I trusted, and I would go back and ask them, this is what I have this decision that I've taken. You think it could have been better? So over a period of, it took me a while, but over a period of time, I sort of settled down with this.
Okay. And you settled down for good for 22 years.
Yeah,
That's a long stint. That's a
it's
long
a long time.
stint. And I think that also talks for the organization, because if a nurse leader is staying in an organization for that long, that also means something for the organization. I hope so. But I am very sure that you had your own, you know, very, high points and probably very low points. So, would you like to share something that you're not able to forget in your career uh, about when it comes to patient care? Something that keeps bothering you, or it has happened, something that you don't forget. We all have. And there is another incident of something very plus about this profession, something that you will never forget. It's kind of a blessing being a nurse. So, there are two questions.
Yeah. So I'll start with the negative. The low point in my career uh, is something which I really would, like to erase from my memory totally. Was the COVID time, and COVID hit Wokhard really hard. If you remember, Wokhard was in the limelight for all the wrong reasons,
Yes,
and
yes.
yeah, and the hospital was shut down. We were in the hospital for 14 days with every positive report for a nurse tested positive. I would break down. It was really bad because we had patient when we had to shut down. We had patients in the hospital, and we had to transfer out all those patients. We had nurses who were turning positive. All over the media, there was news that Wokhar is not really doing good for the nurses, and a lot of wrong publicity that was given. And I had I had ministers from Kerala calling up. I had associations calling up. I had my own staff who, you know, who looked up to us, unhappy with us. Of course, I had my senior nurse manager team who stood by us very, very strongly. So that's one time which I mean, we were in the hospital locked up for 14 days. Food was a problem. There was no scarcity of food, but people were getting fed up eating the same type of food again and again. Parents were getting worried. And every time we thought of streamlining certain things. So when girls were turning positive, we created this system where we said all the senior nurse managers will call up uh, girls who are positive, parents of the girls who are positive of their department, call them up twice a day and give them a health update, saying that your girl, your staff is doing well, she's in so and so hospital, there's absolutely no issue. So there was an update which went from the nurse managers twice a day, which did help. But the smallest of things took us by surprise. We would get calls from ministers, blaming us that you're not providing food for my nurses. And when we call them up, we find that no, I didn't get the fruit today, but I got the rest of the meal. But that's not what is conveyed to the people. I had senior nursing leaders from various nursing councils calling up and demanding explanations. So all in all, it was a horrible situation, and that was one time I said I shouldn't have got into this profession. But yes, we had to stand together. We had our senior management team, our senior leadership team from the corporate office, starting from the MD. At the local level, we had Dr. Parag, who was the head of the hospital, and my very good friend Nina. They were all there with us, and they knew exactly what I was going through. I remember Parag telling me one day, just cry, because he could see me fighting back my tears. So those were very difficult days, but we've come out of it, and we've come out of it very strongly. So that's one unpleasant experience that I've had. Pleasant memories, lot of pleasant memories. I think achieving our first JCI, because I think after Apollo, we were the next hospital to achieve JCI. We were the first in the city, in Mumbai city, to achieve JCI, and that was what should I say? It was quite an achievement, especially when the assessors tell you, that the nursing department has come out very strong, and that's one of the strongest department in the hospital. I mean, that's really an achievement. And there are multiple positive things that can keep talking about, but yeah, these are two things that I distinctly remember.
Okay. I think that COVID time when you were sharing your journey during the COVID time, I was taking also a very deep breath, not because of anything else. I used to cry in my home. I used to feel that I am cheating my profession. I'm not able to be out there in the workplace. So I used to feel very helpless. I said, how come this is the first ever, such a major, disaster happening, and I'm not there with the nurses and with the patients. So I think it was my son who told me, Ki, Mama, you can't be everywhere and everything. So today, what you are, you try to do what you can. So obviously, I gave whatever I could get. I used to get calls for oxygen cylinders, beds, and some people calling about some something not very right. So I was able to call the nursing leaders and try to connect people, connect things, sources, etc. But I think overall, COVID was not a very positive experience for anyone. And I do remember talking to you at that time. Now
Yeah.
that when you reminded, I remember calling you and, asking that how were things. So yes, we all learned from that. Big, big lessons we all learned.
Yeah.
And yes, as a nurse, you would have so many good, stories to talk about. Now, my question is, how did you decide to stay 22 years in the same organization? Is there any mantra, or it was just that you didn't want to go anywhere else, or if you don't mind.
I think what Wokhard gave me was Wokhard is known for its culture, culture where people are happy to come to work, and especially for the nursing department, it was all about empowerment. from the beginning. I mean, I joined Wokhar in 2003, and from the beginning, I told you about Dr. Lloyd Nazareth, who was my boss. He strongly believed, he would call me and he would tell me, Elizabeth,
Where
if
is
a doc
Dr. Nazrat now?
he is in Bangalore, he is freelancing now.
Okay,
Hmm.
I had met him some years ago in Bangalore, and he was associated with Fortis for some time,
Yes, yes,
right?
yes,
Yeah, yeah.
yes, that's right. So he would tell us, he would keep telling me, that if the consultant comes late for rounds, the patient will forgive. If the patient gets a burnt chapati, the patient will still forgive. But if a nurse administers a wrong medication or gives a wrong injection, that's something which is not forgivable. And what he was trying to say is that nursing is the center of all the activities for a patient, because no, it is the nurses who are in touch with the patient for the longest duration of time. And he says, they are my marketing team in the hospital. I have a big marketing team outside, but nurses are my marketing team inside the hospital. If they are able to retain in the sense, if patients, whenever they need help, if they feel that, okay, Wokhart is a place I have to go to, the one, the consultant is there. The second choice is the nursing there is the best. So that, because it came from the top, everybody looked at it very, very seriously. Everybody knew that nursing is an empowered team in the hospital, and that empowerment continued. Even after Dr. Lloyd went, then I had Dr. Karinjekar as my boss. And then I moved to the new hospital, that is Sobo, where Dr. Parag was there. So empowerment continued to be very, very strong among the nursing team. Like I have some of my HODs who would say, either nursing ko haath nahi laga sakte. So it was like that. I would tell my nurse managers, you have to fight your battles. And I tell them very clearly, if you are right, you shouldn't be keeping quiet. You have to fight your battle. If you are wrong, apologize, step back and say, I'm sorry, it was my mistake. This was something which the MD of the company also, like when the new hospital started, the MD of the company would spend at least 3 hours in a month doing nursing reviews with us. Till COVID, we continued that. So everybody in the hospital knew that, MD is coming. She's spending time with the nursing team, 3 hours, 2 to 3 hours she spends with the nursing team, only strategizing and planning how to take things forward. And she trusted the nursing team, like, if she say, okay, hand it over to the nursing team, they'll do it. I think it is that trust by the senior professionals in the hospital. It is the empowerment that I shared. It is the way I could evolve the nursing department that made me continue there.
Great. So I have a different question now. How much of this empowerment you think was driven by you as a leader because you go for assessment in so many hospitals? So do you see a similar kind of a empowerment happening in other hospitals? Or what is it that lacking? Why I'm asking, I just heard a story recently where, somebody was sharing, that the toughest of review, usually it is delegated, and if the leader is just sitting there, the meeting will go in some way, right? Because your presence is good enough. So that made me thinking that, we are supposed to, a leader is supposed to delegate and develop others. But does that mean that you leave them alone when they need you? That's just a doubt I had. It's a recent thing, something happened. So I'm just asking you, what has been your experience going around hospitals? There was a statement given by one of my, facility directors. He used to say, the empowerment is as much as you want to take it.
Yes.
Yes. So, what is your general, feedback? Anyway, there will be a lot of people viewing this video even later. So, there is some nuggets of wisdom can go from you.
So, to the part one of your question about my observation when I go to the other hospitals. Okay. Tangam, when you enter the hospital, when the car stops at the entrance of the hospital, you get a good idea about where nursing is in this hospital. And how do we gauge that? How do I gauge that? The team who stands there to receive the assessors.
Mm.
Sometimes you find the nursing head missing from there. There's no nursing representation there at all. It's only the head of the hospital. You may have somebody from medical admin, you have somebody from maybe general admin, and but you find the nursing head missing there. Um, they take you into the conference room. The presence of nurses are minimalistic. You hardly find any nurses there. Even if the nursing head comes, the rest of them are sitting, she's standing there. Unless I tell her, why don't you sit? So those, and of course, presentation, they keep talking about how empowered the nurses are, but there is a gap between what you are seeing on the board and what you are actually feeling, those vibes that you get within the organization. During lunch, you'll have so many HODs, so many consultants joining you for lunch, but you'll find the nursing leadership missing from there totally. So these are things that you pick up very early during the assessment. And then you have another set of hospitals, where you find the nursing head, the nurse, assisting nurse manager, the nurse educators, everybody there. You find them sitting there, you find them participating in discussions, they are outspoken, they are bold, they come to the forefront for the presentation. You find the others keeping quiet, and they are the ones who are leading the show. So these are things you can make out that, okay, where you see an empowered nurse, because when you're talking about empowerment, there's one standard in the nursing excellence which talks about empowerment, and no matter how good their SOPs, how good their protocol is, how well they answer, what we see personally is something else. So those are things which really help you to differentiate in nursing. Um, Coming to this part of empowerment, it depends on I like the statement you said, empowerment is as much as you take it. That's what I have believed in, and that's what I have been doing all my life. Because if you don't stand up and take responsibility, I'll share a small story about when I started as a nursing head. I started as a nursing head very early in life. I was just about 35 or 36, and when I was told to take charge of the department. And I had as I told you, I had no administrative experience at all. And the hospital started, and we have a corporate office at BKC. This is about 20 years ago. Now, when the hospital started, corporate office people, they thought that, okay, we are the bosses and we go into the hospital, we demand extra care, we should get VIP treatment, blah, blah, blah. And they would actually come, and some of them would throw their weight around really badly. And there was this one difficult person who came in. The mother was admitted, very, very demanding, no matter what you did. The mother was never happy, the son is not happy, the family was never happy. And he would keep sending messages to the CEO who was sitting at BKC. And I had just taken charge of the department. And the CEO was very upset. He would call up the head of the hospital. He would start firing them. And one day he came down for a meeting, and he said, I want to have a meeting because I don't know what's going on in this hospital. And he started off. And he went on talking. He said how bad the hospital is and how bad nursing is. And this is not what we expected. And went on and on. And I'm sitting there. I'm scared. I'm nervous. I'm shivering because he's the CEO of the hospital. I've never seen this man. But then at that point, I said, if I don't speak up now, if I don't take responsibility for my team now, and if I don't tell him what we are doing, it's not going to work out. He's going to leave the hospital thinking this is what nursing is all about here. And slowly, when he stopped talking, slowly my voice was literally shivering. I told him exactly what are the things that were happening in the hospital. And I could tell him because I'm more of a hands-on person. I'm on the floor, I move around, I see what's happening. And that same day when I had gone to meet up with this patient, there's a glass of water sitting just next to the patient. She's ringing the bell. The entire gang of relatives is sitting there waiting for the nurse to come to give that glass of water to this particular patient. So these are incidences which I told him. I said, can the family not do so much? And I don't know what all I do. And but just before I could come into this meeting room, I met my intensivists. They were also fed up, and they made a statement saying, "In लोगों को corporate वालों को अलग सा hospital ही बनाना चाहिए," which also I told the CEO, and I could see him slowly mellowing down. He said, "Okay." In that case, I need to go back and tell my guys that they need to behave well. After the meeting was over, Dr. Lloyd came to me and said, Elizabeth, I'm very happy you spoke out. You could tell them exactly what are the things that went wrong. Because when they talk, it's more of a generic thing. When we talk, it's very, very specific to a situation.
Yeah.
And that day I realized, this is what we are talking. You have to be empowered. You have to take control of things in your hand in a very, very responsible manner. But for that, you need to be equipped with adequate knowledge of what's happening on ground.
Yeah, I think that's a very important lesson for all the nurse leaders. You cannot be running a department from the office only. It's not possible. If you're in the only in the office, you will miss a lot of things which is happening on ground. Before I ask any further questions, so there's one question from Dolly. She's asking, what did you enjoy most in nursing throughout your career? We don't want to miss answering any questions that comes from the audience. That is Dolly Biswas from Fortis.
What I enjoyed most uh, in my career is developing and nurturing young nurses. I think that's something that I love doing. When I find that there are sparks in certain nurses, when I find that there are potential that people are, and I don't know how. It's like people come and tell me, "How do you pick it up?" I don't know how I pick it up. It's like some sixth sense telling me, this girl is good at it. We need to focus on her, and so I love grooming people. I love nurturing people. I don't like to give up on nurses very easily, and and I've seen results and I've seen fruits of it. Last 20 years, the number of nurses that I have groomed, the number of nurses that I have nurtured, many of them in leadership positions, many of them doing really well. They still keep in touch with me, telling me, like if you hadn't picked up that trait in me, I probably wouldn't have, I would have continued working as a bedside nurse. So I love spending time with my nurses. I love spending time with my team. I I don't have this policy which says one size fits all, because I feel every individual is different and they need to be handled differently. And when you can individualize, we talk about individualized patient care. Why not individualize nursing care or nursing team care? Why not give them that? Because I have realized when you're able to give them that, they give you 100%. They are very passionate about you. They are very passionate about the organization then, and they give you 100%.
Rightly said. I think that is sadly the mm, disconnect today, that we somehow become very patient oriented. I think the leaders need to become team oriented, and the team will become patient oriented. Automatically, the everything that you desire will start falling in place. And I think at the end of the day, when we stop being a nurse someday, when we retire, I think all that we feel fulfilled is to remember that how many young nurses we have groomed, how many more leaders you have left behind. I think that's what is great about all great leaders. And I know personally the people who have been groomed by you, they are leaders in their own right. Okay. And also I have a small question along with that. Before that, Manasi here is asking one question. What hmm so, oh my God, I am just trying okay. What makes you so motivated and patient with the nursing profession? This is Manasi Chaskar. I think the question is, what makes you motivated and patient despite the fact, over the years, probably nursing is not what it is to be. I don't know, maybe Mumbai is a different breed of nurses, but otherwise, almost all nurse leaders are struggling with the quality of nurses that they get. Maybe that's what Manasi is asking. What keeps you motivated and patient with the nursing profession?
I think what keeps me motivated and patient is the responsibility and commitment to the chair that I'm sitting on. Because, when it comes to positions, when it comes to titles, everybody's excited about having it. But I tell my team members, it comes at a price, it comes at a cost. And the cost that you have to pay is being patient, being motivated. There has to be internal motivation. You cannot pass on your stress to people, junior to you, because there's a lot of stress that we go through, but it has to remain internally within you. You can't pass that. And I think passion for the profession.
Yes, that's kind of reminds me that during the Holy Week, I was writing something on Thursday, and then I wrote something on Good Friday and Easter. So Thursday was about serving, you know, our own team members, and Friday was about sacrificing. And that sacrifice means when you want to be a great leader, one of the sacrifice you just told is that you have to keep the stress with you. You cannot
Yeah.
pass it on. The people who are going to look after the patient, we should not become the stress for them, right? But it takes practice to be that. I'm very sure neither you nor me, we were what we are today. We learned, right? I also used to be impatient. I also became a ward sister when I had only 8 months experience, and I was like I had a chip on the shoulder, and it was like almost like me, I am the queen kind of a thing. So slowly I learned it doesn't work because I can be a brilliant nurse, bedside nurse, but if I have to become a brilliant team leader, I have to have people skills. There is no other way I can manage a set of people, whether it is one, two, three, four, 400 or 4,000. So I think people skill is very, very important. So Dolly has one more question. They are good that they are asking question. I'm forgetting my questions. Okay. So Dolly is telling, thank you, ma'am. One more thing I would like to ask you is that now that's a very political question. How do you envision the future of Indian nursing?
How do I envision the future of nursing?
This is basically like a anchor asking the question. Madam, how do you see the future of nursing? Thanks, Dolly, for that question. Yeah. Okay.
Okay, so I think we are not yet at a stage where we should say that we have given up on nursing. However, word of caution, we are almost there. And if we don't take charge of things now, it'll be, things going beyond repair. Um, what I find is, say, for example, a nurse who is today, if a nurse has to go abroad, her exit is planned beautifully, in the sense that, okay, you finish fourth year, there are a lot of advertisements talking about, IELTS exams in so and so place, so many attempts. After this, what? There are so many agents, legal and illegal, who are trying to sort of streamline things to make it very, very comfortable for the nurses to leave our country. That's one end of the tunnel. What's happening at the other end of the tunnel, where we want more and more nurses, girls to join the nursing profession. There's no work happening there. There's no the consolidated, structured effort that is happening on the other end of the tunnel is grossly missing at the entry level. And if we don't take charge of that, and this is not only for us, it's for the stakeholders of the country as well. If we don't take charge of that, I don't envision a great future. But as I said, we are at the brim. If we don't take charge of things now, it may be a little difficult for us.
So do you have any advice how we can take charge of that? Now that's a question coming from your answer. I'm just kind of itchy to know that what is it that?
So one of the things that we have started working at SNDT, the Alumni Association, is going to schools or colleges of nursing and making and creating awareness of what nursing is all about and how we can make it a little lucrative for the nurses. When people from Germany can come into our country and meet up with colleges of nursing, not just colleges. So initially they were coming to colleges of nursing, talking to the fourth year students and making it comfortable for them that you learn German, you will upskill you and we will employ you. They have taken one step back. Now what they're doing is they are meeting up with girls who have finished their, 12th grade. They are meeting up and it's so structured. They are meeting up with them, they're talking to them, they're talking to the parents, they're counseling them, they're taking these girls back to their country, enrolling them for a nursing program, a 3 year or a 4 year program, ensuring that they get a job there, not only for them, for the family as well. Now, when this can be done from outside, why can't we have strategies being worked out within the country? No, I think that's something which, people from nursing education, people from nursing practices, maybe the government agency, we all need to sit and rack our brains on how we can uh, look at making nursing more lucrative. We've started with a lot of specialized programs for our nurses. Where is it ending? Where are they getting that sort of a recognition?
Hmm.
So a lot of questions that can be asked. I have no answers to all of them, but yes, we need to seriously think about how we can, make it more and more attractive for more and more nurses to come and join the profession. We have so many nursing colleges getting shut down now because students don't want to do nursing anymore.
I kind of understand that. So I don't want to make this conversation that side, because that becomes a very professional, kind of a dilemma for all of us. I'm going to park that and I will come back to you, Elizabeth, that whether we can take that up under, the Association of Nurse Executives India, whether we can do something. So I have got couple of questions here. So let me try to get that out. Otherwise, they might think we did not answer. What strategies do you use to support the well-being and resilience of your nursing team, especially during high stress periods?
When we're talking about high stress, what are the reasons for high stress? Number one, okay, most of the time it is shortage of nurses, and it's easier said than done that we need to have more nurses within the system, or we need to have nurse leaders stand up and say that I do not have nurses and hence I have to shut down a department. I see my very good friend Dr. Parag Rindani here, and and there are times when I have told Dr. Parag this, and he being a master of a propagator of patient safety and quality, he has always stood by me. And I've been fortunate enough to have bosses like this where I tell them that my nursing ratios are going for a toss. I think we need to shut down some beds. And we've always stood by that. So that's again talking about empowerment.
No,
During COVID times, sorry,
sorry. No. I was just going to add to that, do we lack leaders like your good friend Dr. Parag in healthcare?
absolutely. Absolutely. Because when, it's a difficult chair that he sits on, especially when he is looking at the PNL. It's very, very attractive to admit that one patient and say no because it affects the PNL. But I think it's the ethos of the company. When you asked me sometime back, what is it that attracted you to work hard? What made me staying back? I think these are some of the major things that made me stay back. I felt that I was being heard, and I felt my nurses were
True.
also empowered enough to talk. And like I remember uh, my cath lab nurses, we had this one particular cardiologist who would come in the afternoon at 12 o'clock or 1 o'clock and then start off with his cases till it goes on till 9, 10, 12 at night. And the poor nurses there would be, with those lead aprons standing there for hours together. Some of them married, they need to go back home, they need to cook. They continued that for quite some time. We tried talking to the cardiologist, no response. Finally, one day when I was traveling, I don't know, I was sitting at the airport. I got a call from my nurse saying, "Ma'am, we are not going to assist for this case anymore. Are you okay with it?" I said, "Go ahead." I called up Dr. Parag and I said, "This is going on for a long time. We need to take a call on this." He stood by that decision. Okay. So these are things which make a difference, which makes the nurses feel supported and cared for.
I think it's very correctly told. It is not just the nursing head, it is also equally supporting, head of the hospital. And I can very well kind of understand that why did you stay there for that long time? It's all coming up. And your dear friend Dr. Parag has put a question: advice to the budding nurse leaders. I think you have given a lot of advice, but he asked that you have to answer that question.
Yeah, I think he joined in late. He didn't hear
Yeah,
me.
yeah. So I will tell Dr. Parag you can catch up on the missing part of the video recording on our YouTube channel. So we have Dr. Elizabeth Worke asking, being an academician and into the clinical area, how do you feel? Where do you give the best and advice to young nurses who feels comfortable with academics? So probably the question there is that why should academics even think of services? So Dr. Parag changed his question. Advice
Okay.
to Gen Z nurses. So you can answer
Oh,
Elizabeth Varkey's question and then answer Dr. Parag's question.
um, I think I don't know if a lot of you must have heard about the CMC model of nursing, where we have nursing teachers go into the clinical areas and working alongside with the nurses there. Even abroad, if you have to have your creditors, even the chief of nursing needs to have some experience, being show some hours spent in the clinical areas. Um, what is happening is somewhere teachers who have I mean people who have got into teaching, I'm not saying all, but many of them, when they come for interviews also, I realize when you ask them, what did you do in the last 1 year? I finished my BSc nursing, I've got 89%. I was teaching for 1 year in a college of nursing, and now I want clinical experience. Okay, how do you give an intramuscular injection? What are the landmarks? They have no answer to it. Okay. So I think the message that needs to be given to the teachers is that if you want your students to be respected, you need to come across as a person with good clinical acumen. And believe me, students pick it up. Students have come and told me this. Oh, that particular teacher, she doesn't have clinical experience. We can make out, ma'am. Okay. So I think, Elizabeth, that's the type of message we need to give our teachers. If you need to be respected among your students, clinical acumen is a must. And if you need to have clinical acumen, you need to get your hands dirty by going into the clinical areas.
I totally I agree with you. And I think I hope the new NMBC, the commission that's coming up, will actually do something about it. I think so. So I think we are about 8:07. So we'll take one more question. Is that
I'll answer Dr. Parag's question about
yes,
Gen
yes,
Z
yes,
nurses.
yes.
Yeah.
Yeah. I was telling you, let's take that question.
Yeah, so we've been talking a lot about Gen Z nurses who come with peculiar characteristics, and you can't preach to them. You can't give them instructions. You can't tell them anything. You have to work alongside with them. We need to take them along with us, because if you look at some of their characteristics, when I give talks, I talk a lot about this Gen Z nurses. Some of the characteristics that these people have is, this is a generation who has never ever lived without internet. We never had internet, we never had WhatsApp and things like that. This is a generation which has never lived without internet. So they have information at the tip of their finger. There are studies which say that these children lack social skills. They do not know how to communicate, because even at home, if you see your children, they are on the mobile most of the time. If you have guests at home, they just get into another room and they continue with the mobile. So social skills are missing. Uh, Unfortunately, Gen Z nurses have not seen some of the good old days that we have seen, because the time that they have grown up, what they get to see, what they get to hear is all about war. Crime rates are high, rapes have gone high. There's a lot of negativity that these children have gone through. Now, the battle that I used to fight in my hospital is, so there are two levels. You have the Gen Z nurses who are bedside nurses, the bachas who have just come up. Then I have the nurse managers who are the mid-level people who feel that हमारे time पे तो we used to not do this. So it's important for us to marry one another, for us to get them married to one another, because they have to live with one another. And it's important for us to talk to our nurse managers about what are the characteristics that these nurses have, what they are behaving. The way they behave is not because they want to, it's the generation, the way that they have come up with. And create that sort of an awareness and sensitization that this is a generation, we need to handle them differently. We can't be very rebellious with them. We can't get them into a punitive mode.
Great. I think we all have Gen Z in our families.
Yeah.
You don't have to go very far, but I think when it comes to the Gen Z in the hospital, we do have a little bit of a challenge, right? Relating to them. But if you think a little bit about the Gen Z sitting at home, probably we will be a little bit more patient, I guess. So, Dr. Parag asked kudos to Annie for a wonderful fireside chat, but it's nice to know you remember Annie. But this is not any platform. This platform is by Nurse India with Cigna Healthcare. Cigna Healthcare is my company. I partner with the Nurse India, and Nurse India has been doing this fireside chat with more than 12 nurse leaders across the country, and all of them are recorded. And these are done with the purpose of leaving behind trails of wisdom from experienced leaders for the future generation. Gen Z also someday, some other generation will come. What is that next generation? I forgot the name. Then after Gen Z, there is another generation,
Alpha, beta.
Alpha, Beta. So Alpha, Beta come, then Gen Z will say it was not like that. I think, yeah, Durga is telling Gen Alpha. My God, that name itself is little terrifying. Gen Alpha. Come on. Okay, Elizabeth, before I hand over to Indrani for a rapid fire question, I want to ask you what are your hobbies? We took a lot of questions. It's very interesting that the audience had questions for you. And that is little different from the other sessions. We do have questions, but today I think we had multiple questions from many people. Thank you everyone for asking questions, and special thanks to Dr. Parag for being here. It shows how much you are in awe of Elizabeth Joseph. And Elizabeth,
And the nursing fraternity.
uh, and Elizabeth Joseph is such a great fan of you. But yes, Dr. Prag, I must tell you that you always evoke a very positive emotion. The name, I have never worked with you, but I know you give a very positive vibe. So God bless you. Stay that way. Thank you. Yes, Elizabeth, over to you for your hobbies.
So hobbies, I love watching movies. I watch a lot of movies, especially when I'm traveling. So I write poems. I
Oh,
use,
wow.
yeah.
Write
Uh,
poems.
yeah.
Watching movies. Okay, a lot of people have. So, do you have something ready that you can read for us? Poem?
Yeah, I have something here. So this is something that I had written for at a parish level. We had a what should I say? There was a competition during the grandparents' day,
Okay.
and this is a small poem that I have written from the lens of my daughters towards my mother, because I've actually seen the way she's taken efforts to bring them up. So this is a poem dedicated for her. So this is about my grandma. Now there's a little bit of a South Indian flavor also. The word grandma is replaced by amama in the poem. Otherwise, I think everybody will understand what I'm reading.
I think Amma also, I think it's pretty universal. Everyone knows Amma and then
Okay,
Amma, Mama
amama.
is double.
Okay.
Yeah.
So this is about okay. So God could not be everywhere. That is why He made angels. My angel without wings, my Amama, the superwoman. Amama wants me to be a superwoman too, and she set at this daunting task to pursue. Not the kinds from detective comics who can fly around and whose feet would never touch the ground. My Amama wants me to be a superwoman, a super fine woman, a woman of great integrity, virtue, and modesty, a woman who is God fearing, kind, and values honesty. She made this her mission from the time I was born. Anyone who came her way, she would look at them with scorn. How jubilant she was when I was born, I am told. For lo and behold, I was a most prized possession and also a newest obsession. After all, I was a princess, little princess. All her love and affection she would freely express. Little wonder, she understands me and hears all that I do not utter. My likes and dislikes was never and is never alien to her. She can cook my favorite meal in a jiffy, from chicken cutlets, Indian and Conti. I am in awe of my Amama and love struck by her selfless love. Over the years, as she is growing frail, her spirit is still highly enthused. I thank our Almighty for this precious gift, whose love in my life always oozed. My Amama, my superwoman, Jesus' best blessing showered on me.
Oh, wow.
So this was something that we had submitted to the parish and got the first prize for it.
Lovely. And no wonder that it got the first prize. What you wrote. on your daughter's behalf.
Yeah.
I'm sure the Gen Z does not have the patience to write all that. So I got it. I got it. Yeah, that's lovely. That's lovely. So Indrani, over to you. It's a
In fact, this
so let's
poem's so
do that.
lovely. This would have been the perfect, high to end this lovely discussion on. So I'm actually wondering whether we should even proceed with the rapid fire. But yeah, I think, a big thank you to the audience. This has been one of the most engaging, fireside chats that we've ever had. Just so many questions that I think still a lot of questions that have not yet been answered. Maybe we'll send them across to Dr. Elizabeth, and maybe she can actually respond to them over email or something. We'll try and do that. We can't
I think
promise,
we have pretty
but
much answered all the questions. Looks like I was,
all of them. Okay.
yeah.
So that's good. That it's been fantastic. But okay, let's just have some little bit of fun, and then we will end this lovely conversation. So, Dr. Elizabeth, I have a rapid fire for you. So you will answer without thinking. Just first thing that comes to your mind. Okay. So are you a morning person or a night owl?
Night out.
Are you a beach vacation person or a mountain getaway person?
Beach vacation.
Okay. Yeah, you're a Mumbai, you stay beside the beach. Are you a coffee, tea, or something else person?
Tea, but the something else is an adrak chai that I really enjoy.
Lovely. Ginger tea in the
Ginger tea.
monsoons
Yeah.
by the beach.
Yeah.
So you mentioned you see a lot of movies. I mean, watching movies is one of your hobbies. What's been, I won't ask your favorite movie because I'm sure there are just too many, but what was the last movie that you watched?
It's a Malayalam movie called as Todarum. It's Mohanlal and
How,
Shobna
where did you see that?
in the theater.
Oh my goodness, I have
So
not seen
after a
it.
long time, the kids were not there. My husband and I decided to go out for a movie. So that was a high for us.
Oh my God, Tudarum is supposed to be. I'm just waiting for it to come to OTT.
It's a nice movie. Yeah.
Oh, because the reviews are pretty good. So, Tudaram, Indrani, for your sake and those who don't know Malayalam, to be continued, correct?
Yes.
Tudaram is
Oh,
to be
how
continued.
nice.
Yeah, that's the title of
Intriguing.
the.
That's an intriguing title. No,
Yes,
so
I think the
if you're a movie
movie.
buff, can I maybe tempt you to end this fireside chat with maybe a favorite dialogue? No pressure, just tempting you.
Uh, बड़े बड़े शहरों में ऐसी छोटी छोटी बातें होते करते हैं
क्या
शायद.
बात है.
तो हम भी एक
क्या
डायलॉग
बात.
मारेंगे.
हाँ,
एक बार अगर मैंने कमिटमेंट कर दिया
कर दिया.
फिर तो मैं अपना भी नहीं मानती. बस ये सलमान का डायलॉग है बट आई थिंक आई ट्राई टू लिव बाय दैट बिकॉज आई respect commitments timelines so much and sometimes I need to go easy I think because I can become little fuzzy about others not keeping the timeline तो इसलिए ये सोचना जरूरी है बड़ी बड़ी शहरों में छोटी छोटी बातें होती रहती
होती रहती है.
है
So
तो
on that note,
हम भी दोबारा मिलेंगे.
on that note, we will thank Shah Rukh Khan and Salman Khan once again. Shah Rukh Khan from Mumbai and Salman Khan from Gurgaon. Thank you very much, Dr. Elizabeth, for joining. And thank you, Thankam. You just bring, this chat to life every time. And thank you to the audience once again. You've been a phenomenal audience. Thank you for your questions. I agree with you, Dolly. It was a lovely poem. Very nice. And on that note, we will end today's session. Watch out for the next guest next month. We already have her lined up. And so far, so long. I will not say farewell, but so long. Thank you so much, everybody.
Thank you,
Thank you
Elizabeth.
so
Thank you
much.
so much. Lovely having you here. And this is for all those people who are going to watch this recording. Enjoy the recording, take the bits of experience and make your life's lesson without experiencing those things. It's very important to learn from our elders, and we are canning all of them for the sake of future generation. As long as YouTube is there, all the stories are out there. So thanks a lot, Elizabeth, and your poem also will be there on the YouTube. You can go and watch anytime. Okay.
Thank you, Tangam, and thank you, Indrani, for having me here.
Thank
And I
you.
must thank the audience who joined us. I think they had so many very stimulating questions. I thoroughly enjoyed doing this show. Thank you so much.
Thank you
Thank
so
you
much.
and good night.
Bye-bye.
Bye bye.